So shift moving anteriorly, and I lost the contact.
What was that, Sally?
He said he tried to remove the interferences and he lost the occlusal contact on the posterior.
No, when you get rid of the interference, you only take enough off, so you still got contact. I'm just
And
thinking
reshape
of,
it. Don't reduce vertically. You reshape the slopes of the cusp, the ridges. Make them a little concave rather than reducing the vertical.
just calling Tejas to see if he's joining us. Sally, when you're examining a patient, you give them a mirror and show them things, do you?
Yes.
Okay. So you're doing a co-diagnosis where you're involving the patient while you're doing the examination.
Yes.
I mean, you can do it in a way that you just do the examination and you tell the patient, but I think involving the patient's a lot better, as you do.
Yes.
Are you checking soft tissues?
Yes.
Yeah. Ananth, are you checking soft tissues?
Yes, sir.
Are you using gauze to pull the tongue out?
They don't have gauze. My clinic have cotton gauze, but I use cotton gauze at times. And
They
that
don't
too,
have gauze.
they have gauze, but they cut it into very small pieces that it's hardly of any use.
So why don't
They,
you get hold of some and cut it yourself?
it's like they stock pre-cut gauze in the operatory room. So but I need to ask them to keep some in future.
How can you solve that problem?
I will tell the assistant clerk to keep few gauze pieces separate for me.
Ananth, let us know next week. Write a post-it to solve that problem.
Yes.
You see, Ananth, if you're doing a crown for somebody and they've got cancer, it's a good idea to know they've got cancer. You know, I would also want to check their jaw joint, because if they do have a problem with their jaw joint, clicking or whatever, and you do a crown, and then afterwards they say, oh, it didn't click beforehand, and now you've done it, my jaw clicks, you can say, but in our examination at the beginning, we noticed that your jaw did click. Okay. You obviously need to check for early contacts and for a slide and for non-functional contacts. I don't know what
Sir,
response.
is the slide a good thing or a bad thing? Like,
It means you've got an
slide
interference. It means you've got an interference.
Okay.
I mean, ideally speaking, people, when they tap together in the hinge position, they should be in maximum tooth contact.
Yes.
Ideally. Okay. You also need to check whether the teeth are firm or not. Putting a crown on a tooth that's loose is a wasted time, you know. Also to check on their vitality, whether the tooth's alive or not. Do you have a mirror available in the treatment room?
Yes, sir.
Yeah, good. It needs to be a decent size. There are so many different sizes.
Yes, sir.
Some of them look as if they were, you know, for children, you know, they just, and some of them are too big, but that's about the right size. And you see, mine is directly behind me. So I can reach it, or the patient can, or the assistant can reach it very quickly. Whenever I saw plaque on people's teeth or inflammation, I'd immediately show them. So this would be the setup for a dental examination. There'd be a front surface mirror. Are your mirrors front surface, Anand?
So on surface sense, like one-sided.
Do you know the difference between front surface and non-front surface mirrors?
Are they non-reflective?
Well, the silver is on the front of the surface, not on the back.
I think it's
Right.
the back surface. The one which I have in clinic is having a back coating.
Because if you've got the silver on the back, you see a double image.
Okay.
The light hits the glass, it bends, it hits the mirror, and it comes back and it bends again.
Okay.
So they should be front
Doesn't have
surface
that
mirrors.
issue. Maybe it's front surface. It's clear in that mirror. There's no double image. I think it might be front surface.
Have a very close look, okay?
Yes, sir.
So you need a probe, and you can see how important gums are compared with teeth in my thinking, because I've got both the periodontal probe and the probe on the same instrument. You got any of these yet, Sally?
No, not front surface.
Are you planning to?
Yes.
Okay. Which year?
Now.
You know the number of the probe? The Hughes-Speedy probe?
WP6. WP6.
Something like that, yes. Okay, I may have it in a minute. Do you have any clip tweezers?
Yes.
Anand, do you have clip tweezers?
No, sir. I have another. Instead of a clip, it's a needle-like projection. Doesn't have a clip.
You see, on this tray, you notice the cotton pellet is already in the clip tweezers ready. Now, if you don't have clip tweezers, the assistant can't get the things ready. And what happens then is that if your assistant picks up the cotton pellet with the tweezers that aren't clipped, it's very difficult for them to pass them to you. Okay. Do you have ethyl chloride or something like that, Ashwin?
I haven't seen one, so I think the endodontist, she has it. I have not got the chance to use it. I think it's there, so but I've not seen it.
How do you check for vitality of a tooth then that you're going to crown?
So most cases that I do are endodontically treated. So, vital cuttings usually do. Most of the cases they do an endo treatment.
You only put crowns on patients with who've had endodontics.
Yes, crowns mostly are endo treated. Sometimes I use veneer for laminate veneers. Only I do vital.
Hmm. And this is the size of gauze you need. Okay. We buy them, they're 7.5 centimeters by 7.5. You use them for retracting the tongue to protect the airway. How do you protect the airway when you're putting a crown in the patient's mouth?
I'm not able to protect.
Do you protect the airway, Sally?
No.
So when you first have a patient inhale or swallow a crown, you'll wish you had.
Yes.
My dental assistants would not allow me to put any small object into a patient's mouth without putting gauze in already. They would put it in.
Right.
Okay, Anand, make a note that you're going to protect the airway when you're putting crowns into the patient's mouth, temporary crowns or permanent crowns. Okay. So we open the gauze out. It comes doubled. Okay. We open the gauze out and we put another gauze on like this. And then we fold the left end over. And then we put another gauze on top. We fold the other side over. And then we do this numerous times. And then we put them in a container like this. Elder used to have this, didn't he?
It is very nice, easier to.
What was that, Sally?
It, as it was, I have seen this in Andros's clinic. It is very helpful, sir, to take the gauze. It's easier to dispense this way.
Sally, do you hear him?
Yes.
What's he say?
He said he has seen this in Eldo's clinic and it's really useful to get gauze out
Yes.
whenever
yes.
need be.
Yeah. So we put it into this container and then put the lid on top, which is loose. That keeps it flat down. So then we can just take gauze like this. Makes it so much easier. And we had the same thing for tissues. When I'm in people's clinics and I say, where's the gauze? It can be anywhere in the room. Never or rarely in exactly the same place where the assistant and the dentist can pick them up. And the gauze is often a pile of gauze. You can have these containers like this made. Even if they're made out of wood, that would be better, okay? So you see the use of the gauze there, Anand.
Yes, sir.
I went to the dentist the other day. Every time you put the mirror into my mouth, you hit my teeth. Every time. Are you doing this, Anand?
At times, not.
You mean on Monday and Wednesday you do this, and on the other days you don't do it? Remember to put the mirror in like that, okay? And then turn it.
Yes,
Do you ever do this?
sometimes.
I wouldn't do that. It's grabbing hold of the patient. I think it's terrible.
Yes, sir.
So you put it in and then turn it. So this is what the dentist was doing with me. So it's useful to have two mirrors when you're checking the soft tissues. And then you look under the tongue. So then you put a tick on the examination sheet. Are you using sheets like this, Sally?
No, I use the software.
Oh, I see. Do you find the software restricting?
Sometimes, hello, sometimes, yes,
Yeah,
but I am able to add all of this.
you can.
Yes.
So do you have this list of things to look at?
No. I have added the medical history part and the dental history, but not the evaluation, soft tissue evaluation.
Can you do that?
Yes, I'll check with that guy tomorrow.
Okay. Do you have this sheet?
Yes, I do.
Yeah. So if there was an ulcer under the left side of the tongue, where could you put that in the notes?
I can add whatever data in the clinical note, but there has to be mention of these things where I'm able to add that I'll get it added. So I have to actually enter.
Can you enter things in red?
No.
You check to see if that's possible.
Okay.
You see, I went digital many, many years ago and became much more inefficient. So this is checking the jaw joint. 3 or 4 fingers either side over the joint. Have the patient open and close, go to the left, go to the right. And then if you want to double check, Ananth, put your fingers over your joint, both hands. Okay, several fingers. Open, close, go to the left, back, go to the right, back, and go forward, back. Did you feel anything?
Sometimes I hear a click and feel a click on my left jaw.
Okay,
Left
now
side
put your
of my
little
jaw.
fingers in your ears, pointing forwards. Okay, open, close, open, close, go to the left, back, right, back, forward, back. Okay. Ashwin, have you heard of Bennett shift?
Yes, sir.
Have you ever felt your Bennett shift?
Yes, sir.
You have?
Slightly, sir.
Yeah. Put your fingers in your ears and go to the left. Which condyle moves most?
The left side convex working, sir.
Does the right one move a little bit?
Yes, sir.
That's the Bennett shift.
Yes, sir.
Okay, now go the other way. And which one moves?
The left one.
Okay, and does the right one move?
Yes, sir.
Okay, that's the Bennett shift.
Yes, sir.
Okay. A soft click, a hard click, you can hear it across the room. Okay, a soft click, you can't hear it. Okay, you probably have a soft click, Anand.
Yes, sir.
Yeah. Anand, if you tap your teeth together fast, do you feel a clatter or not?
Yes, sir.
Okay, so that's one thing you can do with patients. So some of your teeth hit a little early. Okay.
Yes.
You have to remember that people with interferences may live to 85 years old, and they can do damage over the years. So you're doing this occasionally, are you, Anand?
Yes, sir.
You are? Okay, good. You see, if you don't check occlusions, can you imagine the amount of stuff you're not looking at?
Yes, sir.
Are you busy all day, 6 days a week?
No.
No. Is there somebody in your clinic who looks after patients with jaw joint problems?
No, sir. Only if the patient complains, only they mostly check. So,
No. And is there somebody, a dentist, who looks after patients with jaw joint problems?
not really, sir. No.
You could be the one.
Yes, sir.
Okay. If you're not busy, you could tell the other dentist, let me have any patients you've got who've got jaw joint problems or headaches.
Yes.
Okay, so you can keep busy. Okay.
Yes, sir.
So I'm getting the patient to tell me where the interference is. At this stage, I didn't know exactly which tooth it is. I just need to know if there's an interference on which side it is. I mean, this patient came to me, he was probably about 35 years old. Nobody had checked and noticed this interference here. So he's got an early contact, EC early contact, left. Now check to see if there's a slide from maximum tooth contact to from hinge position to maximum tooth contact. So he hits on here and he goes into maximum tooth contact. This patient had about 4 symptoms. And after I got rid of the interference, all the symptoms went. So he's telling me he's got a slide. Now I'm checking for non-functional contacts. And I'm saying to the patient, I tap the patient on the shoulder on the non-functional side. I said, do your teeth touch on this side? So the lower model has gone to the left. So this is the non-functional side. This is another patient who was in his 40s. you'd had a headache since the age of 10. That's 30 years worth of headaches. Now he's going to the right, and he's got an interference on the left side, the functional side, the non-functional side. Okay. People are not used to being asked to move their jaw from the left to the right or whichever way. They're not used to it. So by just touching them on the side of the face, it helps them know which direction to go. Have you in the last few weeks come across somebody with a non-functional contact, Anand?
Yes, sir.
Could you see their front teeth
sir.
opening up?
Yes, sir.
Okay, so it's quite a big non-functional contact.
Yes, sir. It is on, sir. It is slightly lingually till on.
Now, do
I,
you have articulating paper holders?
yes, sir.
If a patient
Yes,
moves
sir.
their jaw to the right and the front teeth separate, you can see, you don't need to check with articulating paper. Okay. But if you can't see the front teeth separating, then you might put the articulated paper in like this and pull gently on it and have the patient go to the right, and you pull and see how quickly this comes loose. Okay. Do you do that, Sally?
Yes.
Yeah. So this patient's NFC, non-functional contact.
So I lost you. Got disconnected, sir. In between.
Say that again,
It
Anand.
got disconnected in between, sir. I lost you. What you were saying.
When I was talking about this,
Anand, you want him to repeat this point? I think there's some internet issue at his end.
Say if the interpreting paper. Ma'am,
can you hear him, Sally?
No,
I didn't.
Anand is,
Sir, yes, ma'am. Tell me.
yeah, he's asking you if you want him to repeat this point, the slide where it is.
Yes, sir, yes.
Yes.
So you
Yes,
put
sir.
the
Could you repeat?
articulate paper in like this, Anand, and you pull
Yes, sir.
very gently and have the patient go
Yes,
to
sir.
the other side, move their jaw to the other side, and you see how quickly it comes free. This is for very small non-functional contacts. Okay.
Yes,
If it's a big non-functional contact, you can see the front teeth separating.
yes, sir.
So put NFC, non-functional contact, on the right. Now you do your charting on your computer, do you, Siley?
Yes.
Okay, now let's see how you can do what I'm about to show you. This was one of my earlier examination sheets, Siley, which I used about 30 years ago. So on the left, it's got ST, soft tissue, joint, early contact, non-functional contact, teeth, vitality, firmness, and then a gum check to remind me. Okay. Anything that's a problem would be in red. Now, you can chart missing teeth, presumably, Siley.
Yes.
Okay. Can you chart whether the tooth's alive or not alive?
Yes.
Okay. If a tooth is over erupted, can you chart that?
No.
Okay. If it's discolored,
No.
can you chart the fillings?
Yes.
Okay. And if it's a deciduous tooth,
Yes.
you can. And if it's mesioangle impacted,
No.
okay. This is the number, Siley.
Yes. Yes.
You got that. And then you could buy some of these, you know. You can get some things, you ought to buy some things for yourself, okay? So that when you do start your own clinic, you've got some things already. Okay. Do you know where to get Hugh Freedy instruments from, Anand? You know where to get them from, can you, Siley?
Yes, I do.
Yeah.
But this probe wasn't available when I had last ordered stuff. I ordered a few more things. I don't remember what you had recommended, but this
Yeah.
probe, they had only single-ended probe, not this one. So
And did you ask them? Did you ask them to get them in stock?
Yes. So they didn't call me back. Neither did I.
Okay. You harass him. Okay.
Yes.
So this is the number. Oh, wait a moment. Can you take a screenshot, Anand? Or take a photograph with your camera, your mobile phone. Your connection today is not very good, is it, Anand? You're muted at the moment. And if you need me to send this to you, let me know, okay?
Yes, I've taken a screenshot, sir. My
Yeah.
internet is a bit slow.
Okay.
I have a Mumbai number also. I'll send on the group.
Yes, sir. Sure.
Now, I don't stick this probe into people's teeth. My mother used to do that, and it was a horrible thing. I just use it to point to where I'm looking. Okay. I suppose I might probe a fissure just in case, but you want to be careful with this, I think. It's not pleasant for the patient. So this would be a routine thing. Any big filling, I would check for vitality. I certainly wouldn't put a local anesthetic in until I know whether the tooth's alive or not. And if I'm going to be replacing the filling and it doesn't respond to ethyl chloride, I would then drill into the tooth just to check that it's not alive. Okay. Otherwise, you're going to be putting fillings into patients who've got dead teeth. If you have a patient come in who says, oh, I have pain when I drink hot drinks, then I would use some boiling water in a in a syringe. I prefer to do that than use hot green stick. How do you check patients who say they've got pain with hot drinks, Sally?
With a gatta parcha or a green stick.
I prefer to use boiling water. Okay. How do you chart a tooth that needs a root canal treatment, Sally?
So I can show a periapical abscess or something which indicates that it needs a root canal treatment.
Okay, but what happens if it needs a root canal treatment? It doesn't have a periapical abscess.
I can show the pulp red. I can show that it's hyperemic and
But
it
it might
needs
not be
treatment.
hyperemic.
Yeah.
So you see where that yellow arrow is, very clear.
Okay.
You see, I personally would not use a computer for charting. Now you see these lower teeth are moderately loose. Can you chart that?
No.
Or bone level?
No.
No. I'm sorry that Anant is not with us because I'd be interested in what he can do with his computer.
I think he can listen to us.
Sir.
Anand? Yeah.
Yes, sir. I'm able to. Am I audible, ma'am? Sir?
Yes.
What did he say, Sally?
He wants to know if he is audible. He can hear us, he said.
Yes, yeah. As you know, Anant, I don't understand some Indian English. And that's because I'm dyslexic. Okay, and dyslexic people have difficulty in different accents. Okay, so it's not your fault. Do you ever tap teeth to see if they are sensitive?
Yes, sir.
You notice I'm tapping with a some tweezer handle.
Yes,
Why
sir.
do you think I'm not using the mirror handle?
It's broader, sir. Can't give a point force.
Yeah, my mirror handles are plastic.
Okay.
Okay. And the reason why I would use plastic mirror handles is if you're using electrosurgery, if you touch the mirror handle and it's metal, the mirror handle becomes an electrode. So you can burn the patient. Do you ever put a cotton roll in the patient's mouth and ask them to bite on it to see which is the sensitive tooth?
Yes.
You do. Sometimes I'd use a toothpick. Okay. Checking for firmness. I used to check to see if teeth were loose, but I thought that's very negative. I'm also trying to find out which ones are firm. So then I'm ready. Ready to do a gum check. Okay. Sally, I'd be really pleased if you could send me some photographs of some chartings. I presume you can't put your bleeding index charting on your computer.
No.
So you have that on soft, on paper.
Yes.
Yeah. What is your best result you've had so far?
Drastic result in most of them, but one or two not so drastic. Like in uh, in a follow-up after 6 months, one patient went from 73% to 34%.
To 34%.
Yes. And there is one or two who are like from maybe 80, 85, they are still in the 60 zone.
Are they toothpicking?
I've given them all the toothpick, I've given them tape brushes, but they keep coming back with lots of tartar. And he just was saying he can't do it probably. He doesn't, he agreed that he is unable to do it well. So, but now he is regularly following up and aware of his starter. He sees it and then he comes back to get it clean. Only one person.
How many patients have you done bleeding indexes on that have got moderate pocketing?
I'm not sure. I'll have to check the file, but maybe 10 or so.
Are you planning to do a scale and curettage for them?
Or deep scaling. I don't do cure touch
Why is that?
because I don't know if it is really helpful.
Oh, my heaven's sakes. Of course it is.
Okay.
You put the local anesthetic in a quadrant.
Okay.
You curette out all the granulation tissue. You do root planing,
Mm.
and then you and then you do more curettage.
Okay.
Takes about an hour and a quarter. And then you see them 2 weeks later and get them back to cleaning again.
Okay.
I mean, this is just routine treatment.
I thought they don't do it anymore. They just give anesthetic and do deep cleaning. It also causes recession, bone loss.
Doesn't cause bone loss. It stops bone loss.
Okay.
So you're leaving patients with calculus on the roots because you can't get down there far enough unless you anesthetize the patient. And you're leaving with them the granulation tissue. So the bone loss is going to continue. You see, unfortunately, patients don't get the treatment they need because of the thinking of the dentist. If I came to you and you did a bleeding index and you found that I'd got, say, 5, 6, or 7 millimeter pockets, and you didn't teach me how to toothpick, interdental brush, and the Bass technique of modified Bass technique of brushing, then you'd be failing in your duty to me. And then if you didn't do a scale and curettage quadrant by quadrant, then you'd be failing me again. At the moment, Sally, your patients are not able to get really healthy because
Right.
you're not providing them with the treatment.
Okay.
Yeah. Now, of the patients you've done bleeding indexes on, how soon afterwards have you done the second bleeding index?
In some, I've called them after a month. Some have come after 3 months and some 6 months.
Yeah. Okay. I think as a generality, after 3 months. If the patient isn't doing what you suggested, then you're better off spending the time getting them to do it. You know, I mean, bear in mind that it takes 4 or 5 visits to teach toothpicking, probably more teaching them brushing. The interdental brushing is a bit easier because if they're toothpicking, they know how to toothpick, so they know how to use the interdental brushes. I mean, I never, as I've told you before about, I've never measured pocket depths, complete waste of time. I know every time I do a bleeding index whether there's pockets there or not, and whether the patient needs a scale and curettage. Now, if you have not up till now believed in scale and curettage, why do you think they're a periodontist? What do they do? They unnecessarily cut gums like anything. and they don't spend a great deal of time on the patient's cleaning. Just 1 second.
Abhi is trying to join.
I know, but she doesn't. Oh, okay, okay. Hello, Abby.
Sir, extremely apologies, big apology.
You've been seeing patients.
Yes, sir. Got two emergency patients. They were having a lot of pains, like back to back. So
How is it that they always seem to have an emergency on a Thursday at 8 o'clock or a Friday at 8 o'clock?
it's not always, sir. It's like it happened first or second maybe.
I mean, sorry, we're talking about treatment of patients with pockets around their teeth, Abby. I can't see any reason for referring a patient to a periodontist if the general practitioner is looking after the patients properly. The only reason for referring the patient to a periodontist is if they're so busy with everything else, they don't have time to look after the patient's gums. What time is it with you now?
9:25.
Do you want to finish or go on?
Finish.
Right. Okay. It's a pity because we've now, Abby, I do appreciate you even now
Say hi.
allowing us to see your bright face. It's very encouraging.
So I wanted to have all ready. I was all set up, but I don't know. I'm extremely sorry, sir.
I'm still intending to be in India in middle of June. I'm having the problem of dealing with people who say they'll do something and then don't do it yet. So I'm hoping to be in Hyderabad and Delhi.
Okay, sir.
And maybe Lucknow, I'm not sure.
Nice. Okay, sir.
But in November, I'll be back. In October, I hope to be back in again to do the second occlusion course in Hyderabad. But I'll let you know about that, okay?
100%, sir. Okay. Thank you so much, sir.
I'll hope to see you next week.
100%, sir. I always try my 100%, but some way or the other things.
Does anybody look at the videos I send?
No, I haven't seen them.
Because people say to me, have you turned on the recording? I do. and then I send you the video of the session. I mean, it's up to you what you do, obviously. Okay, then, Sally, you'll send me the bleeding index information, okay? But
Yes.
have a look at your patients that you've done. When you look at them and you probe them when you're doing the bleeding index, just see how many of them have got pockets over 4 millimeters.
Okay.
Anybody with pockets over 4 millimeters is highly likely going to need to have a scale and curettage.
Okay.
And you do one quadrant, see them 2 weeks later and get them back cleaning there again. And then you see them a month later and you do another bleeding index.
How do we remove the granulation tissue? We just cut it with scissors once you reflect the flap. Or you use a scaler to hand scaler.
I'm sure I've gone through this with you. I
I
will,
think it's
Sally, I'll send you the presentation on what to do.
okay.
Okay, and I'll send it to all of you. Now you curate it out with a scaler and with an excavator.
Okay.
Have a look at the patients you've done. When you are looking at the ones you've done bleeding indexes on, Sally, have them come in and check their pockets, okay?
Yes, I will.
Right. So you do a scale and curettage of a quadrant. You see them 2 weeks later and get them back to cleaning again. You then see them a month later and do a bleeding index to see how much improvement there is. Then you do another scale and curettage of another quadrant. 2 weeks later, you see them again, then a month later, and then you do another quadrant. Okay? I mean, you spread it out as it's convenient to the patient.
Okay.
But when you see the first quadrant is so much better than the other quadrants, you become motivated, okay? Yeah. I'm just sad at my age now that dentistry is so poor in the world. In America, the hygiene business is a complete con. You get all these patients coming in every 3 months and every 6 months to have their teeth cleaned. I have my teeth cleaned once every 20 or 30 years because I keep my teeth clean. They may be a little stained, but they don't need to be, I don't need to see somebody every 6 months. It's an absolute con. But do you think that's a popular idea in the States? Of course it's not, because they have an income coming in. A friend of mine, his hygienist said that she wanted an hour and a half for each appointment every 6 months. What the hell was she going to do for an hour and a half? Absolutely ridiculous. I don't feel strongly about this. I feel absolutely mad about it. Okay, I'll see you next week.
Okay.
Okay, sir.
I will be sending you the draft of the email I'm planning to send to the patient in the next 10 minutes.
You've revised
that,
it.
To that patient, I'll just send you the draft.
Is this the one? Oh, yes. Send me that draft. Yeah. Okay, then.
Yes, I'll send it to you in the next 10 minutes. After
Right.
your go ahead, I'll email it to them tomorrow morning.
Yeah.
Okay.
Thank
Cheers
you.
then. Bye.
Bye bye.
Right.
Bye.
Right.